Hello everyone, welcome again to my YouTube channel. Welcome to my presentation. Our topic is all about Rad Anatomic Position. Radiology Anatomic Position refers to the patient standing erect with the face and eyes directed forward, arms extended by the sides with the palms of the hand facing forward, heels together and toes pointing anteriorly. When the radiograph is displayed in this manner, the patient's left side is on the viewer right side and vice versa. Professionals in medicine always describe the body, a body part, or a body movement as though it were in the anatomic position. Posteroanterior. The anterior or front aspect of the patient's chest placed closest to the IR for a posterior anterior PA projection. This image, the anterior aspect of the chest is closest to the image receptor. Antero-posterior. The posterior or back aspect of the patient's chest placed closest to the IR for an anterior-posterior AP projection. This image is the posterior aspect of the chest is closest to the IR or image receptor. Regardless of whether the anterior or posterior body surface is closest to the IR, the radiograph is usually placed in the anatomic position. This image represents the radiograph of the posterior anterior projection in the and anterior posterior projection of the chest. Both radiographs are correctly displayed with the anatomy in the anatomic position, even though the patient was positioned differently. Note that the patient's left side is on your right, as though the patient were facing you. This image represents the proper placement of the patient and body part position for a posterior anterior projection of the left hand. Hand and wrist radiographs are routinely displayed with the digits or fingers pointed to the ceiling. Foot and toe radiographs are also placed on the illuminator with the toes pointing to the ceiling. Hand, wrist, toe, and foot radiographs are viewed from the perspective of the X-ray tube, or exactly as the anatomy was projected on the IR. This perspective means that the individual looking at the radiograph is in the position of the X-ray tube. This image represents the left hand position on the IR or the image receptor. This view is from perspective of the X-ray tube. Radiograph of the left hand is placed on the illuminator in the same manner with the digits up. Lateral radiographs. Lateral radiographs are obtained with the patient's right or left side placed against the IR. This image represents the proper patient position for the left lateral chest. Note that the left side of the patient is placed against the image receptor. This is the radiograph of the left lateral chest, placed on the illuminator with anatomy seen from the perspective of the X-ray tube. They are generally placed on the illuminator in the same orientation as if the viewer were looking at the patient from the perspective of the X-ray tube at the side, where the X-ray first entered the patient, exactly like radiographs of the hands, wrists, feet, and toes. Another way to describe this is to display the radiograph so that the side of the patient closest to the IR or image receptor during the procedure is also the side in the image closest to the illuminator. Oblique radiographs. Oblique radiographs are obtained when the patient's body is rotated so that the projection obtained is not frontal, posterior, or lateral. This image represents the left anterior oblique position for posterior anterior oblique projection of the chest. This radiograph is placed on the illuminator with the anatomy in the anatomic position. Note that the patient's left side is on your right, as though the patient were facing you. This image represents a radiologist interpreting a radiograph for a patient's left shoulder. Note that the radiograph is placed on the illuminator with patient's left side on viewer's right side. The radiologist especially pictured the patient's anatomy in the anatomic position and then place the radiograph on the illuminator in that position. Additional information and responsibility make it necessary for radiographer to know the following: normal anatomy and normal anatomic variation so that the patient can be accurately positioned. The radiographic characteristic of numerous common abnormalities. Although the radiographer is not responsible for explaining the cause, diagnosis, or treatment of the disease, the radiographer's professional responsibility is to produce an image that makes the abnormality evident. Okay, that's all for today. I hope you gained some knowledge in this video. Hope you like it. Please like and subscribe for more updates and topic. Thank you for watching.